Two.
Hello, everybody. Good afternoon, and welcome to our weekly media briefing and public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today is Health Officer Dr. Keisha Davis, as well as Dr. James Bridgers, who is the Chief of Public Health Services. Mr. Sean O'Donnell, Program Administrator, Public Health, Emergency Preparedness and Response for the Department of Health and Human Services. And we have a special guest today, Adriana Hutchberg, who is the Interim Director of the Department of Environmental Protection for the county. Members of the media, thank you for joining us today. Remember to use the chat for the Q&A portion of this presentation. And with that, good afternoon to you, Mr. County Executive.
Good afternoon to everybody, and thank you again for joining us. I want to start by just talking a little bit. I went down to DC yesterday, and I heard the President of the United States address the NACO conference, National Association of Counties. And it's a good thing when he happens to mention Montgomery County specifically as a model for everyone in the room in the nation to follow. So that was good to hear. It happened yesterday at the conference, and President Biden told the group of county leaders that about our efforts to electrify our bus fleet in Montgomery County. Our county's robust efforts have turned heads and become model for the rest of the nation. And last fall, we cut the ribbon on our innovative Brookfield microgrid electric bus charging station. And so far, we've got 4 ride-on buses in operation, 10 more about to be delivered. And we also have an RFP out to purchase another 100 ride-on buses. And we've been working with MCPS to electrify the school bus fleet. And they're having 326 diesel school buses replaced by electric buses by 2025. They will be entirely electric within 10 years. The president amplified our message that if counties can figure out the financing and the partners, they can do the same thing. And he recognizes what an important environmental win this could be for the nation. And we do think that, we've been able to show people ways of doing things that are that aren't normally thought of, or people have not realized were possible. And so we try to continue to not only do what we do because it's important for us to do it, but to bring other people into the discussion. Electrifying our fleet is only one of many avenues we're taking to achieve our climate action goals of 100% emission reductions by 2035. We have plenty of reasons to be proud of our environmental record. Our climate change officer, Adriana Hutchberg, was invited to be a part of a panel at the same National Association of Counties conference. And Adriana's panel focused on energy and climate change measures that could be tied into the president's Inflation Reduction Act. I want to invite her to speak to you now to go over some of her takeaways and talk to you about the county's progress toward carbon neutrality. And afterwards, she and I will both take climate-related questions. I just want to say that there's not a day that goes by where there's not some more incredibly worse news about the climate. And, this morning's reading for me was the warming of the Antarctic ice sheets from underneath, and the fact that these sheets are seriously in danger. And we're not talking, I remember when this started, people were talking about how many centimeters the ocean might rise by the year 2100. Now they're talking about how many feet it's going to rise, and that one single event in the Arctic could lead to a 10-foot rise in sea levels. That's just, in the Antarctic, that's just the Antarctic. So we are dealing with a problem that's going to require more and more attention. And I'm going to turn it over to Adriana to talk a little bit about what she's been working on and what she heard.
Thank you, Mr. County Executive. I had the opportunity to participate in the National Association of Counties annual legislative conference in a panel to talk about Montgomery County's climate initiatives. The panel was focused on the ways in which counties are working to take advantage of the opportunities in the Inflation Reduction Act. And I was joined in the panel by the Honorable Adrian Garcia of Harris County, Texas, the Honorable Angela Conley of Hennepin County, Minnesota, and Christian Roberts with KPMG. I shared that Montgomery County was one of the first local jurisdictions to declare a climate emergency back in 2017. And as the county executive shared, our climate action plan serves as our roadmap to reduce our greenhouse gas emissions 80% by 2027, fully eliminate greenhouse gas emissions by 2035, enhance climate resilience, and center racial equity and social justice. Because of the county's ambitious climate goals, we already had many initiatives underway prior to the passage of the IRA and the bipartisan infrastructure law. Both of these laws will enable us to leverage our existing climate initiatives and take them to the next level. And there are three examples that I shared with the panel. The first one is BEPS. Last year in 2022, Montgomery County became the second county in the country to pass Building Energy Performance Standards, or BEPS, legislation to tackle energy use in our existing commercial and multifamily buildings. Now, we know that some building sectors, like condominiums, may be challenged to meet new requirements. Many of our condos are aging buildings and may not have the reserves where they need to be at. So we are planning to apply for some IRA grants from the U.S. Department of Energy to help these buildings perform whole building load analysis. The second example is with regards to zero emission vehicles. And as the county executive just shared, and as the president underscored in his remarks yesterday, Montgomery County is at the epicenter of the EV bus revolution, with both school buses and transit buses already going electric. Thanks to the IRA, we're also looking to use a direct pay mechanism to add even more EVs to our fleet. And we're also looking to invest in hydrogen transportation infrastructure. Our county's Department of Transportation has already been awarded a $50 million federal grant from the bipartisan infrastructure law for 13 hydrogen fuel cell buses and a green hydrogen fueling station. This project will be the first public transit application of green hydrogen in the East Coast. The third example that I shared is about leveraging funding for the Green Bank. Montgomery County has a Green Bank in place. It was launched back in 2016, and it leverages capital and innovative partnerships to make clean energy and climate resilient solutions more accessible and affordable for county residents and businesses. The Green Bank is looking to take advantage of IRA funds, including the EPA's Greenhouse Gas Reduction Fund, to access more dollars to get projects done here in the county. Now, these three examples are just a few of the dozens of climate initiatives that are underway in the county. This morning, the county released the Climate Action Plan Progress Report of our second quarter of fiscal year 23. I invite you to read about the dozens of actions that are underway related to clean energy, buildings, transportation, climate adaptation, carbon sequestration, governance, public engagement, and zero waste. And you can find the progress report by going to our climate action portal, which is located at montgomerykountymd.gov/climate. And we'll also be including the link in the chat. And on a related note, the Department of Environmental Protection's 2022 year in review video was just released last week, and it highlights both the climate and other environmental projects that the department accomplished last year. It's a short 10-minute video, and I encourage you to check it out. It's on YouTube, and we'll post the links in the chat as well. The NACO panel also discussed how counties can help communicate to the public the many IRA tax credits, rebates, and other resources that are available to them. I talked about how it starts by making information available that people can get to at their fingertips. We have the Montgomery Energy Connection website. It's a clearinghouse of information about ways to save on energy bills, go solar, and implement energy efficiency practices. We've added information about federal rebates, tax credits, and incentives here on this site. And Montgomery Energy Connection can be found at montgomeryenergyconnection.org. We'll also include the link on the chat as well. And the White House also has a website that gives an overview of the IRA incentives, and that's located at cleanenergy.gov. Many rebates are already available right now for people to take advantage of, so please help spread the word. Within the county, we have something called the Climate Change Communications Coalition, which was formed with representatives from 12 departments and agencies to leverage and coordinate our collective communications channels to get the word out to residents about actions that they can take, including taking advantage of the IRA rebates. But we know that websites and newsletters, while necessary, are not sufficient. We need to connect with people more personally and go where people are. The Department of Environmental Protection already offers events at the libraries where we provide free light bulb exchanges. We need to build on this approach of interacting directly with residents to help answer their questions about IRA rebates. We also need to tap into our community partners who are trusted sources of information for our residents. And we need the information to spread through word of mouth as well. Neighbors telling neighbors, their own neighbors about the work that they have done in their homes and with their vehicles. The panel closed by discussing what counties are doing to meet the moment and achieve ambitious emissions reduction goals and our recommendations for other communities. I shared the need for local county teams across the country to be staffed properly. It takes people to manage grants. Climate teams need staffing up for sure, but all the work can't be done by the climate team alone. Everybody in county government needs to step up and to own the issue of climate change. This includes general services, DOT, the health department, libraries, name it. Every department director needs to recognize that addressing climate change is a part of their mission. We can only succeed if it's all hands on deck. I also shared that our community partners and local organizations need resources to be able to dedicate their time to this. In many cases, the resources have not historically been there to support climate work by our local community-based organizations. Now, some of the IRA funds do include grants to remedy this, but community partners will first have to get through the grants gauntlet to access those dollars. Finally, in terms of how the county is specifically gearing up to apply for these federal grant opportunities, I shared that we are lining up external grant writing support. We're also staffing up with staff to lead the development of grants proposals and administer grants. DP received funding in our fiscal year 23 budget for a new grants position. We're also looking to partner with other Maryland jurisdictions on grant applications, including through the Maryland Clean Energy Center. And lastly, we are developing a request for expressions of interest, or REOI, to pre-qualify partners. We anticipate that the REOI will be released by the end of this week. Partners can include for-profit, nonprofit, and educational institutions that have the capacity and interest in partnering with the county on future funding opportunities. Thank you, and we're available to answer any questions that you may have.
Thank you very much, Interim Director Adriana Hochberg, members of the media. If you have any questions regarding climate and or environmental protection issues, this is a time to ask your questions, and we'll give you a second or two to get engaged. Any questions on any of these issues? All right, going once, going twice. I guess not. Thank you very much, Director Hochberg, for joining us this afternoon. And Mr. County Executive, we can move forward with the rest of the public health update and other issues.
So thank you, Adriana, for joining us. And I'm looking forward to the Energy Summit next month and Earth Month activities in April. There's a lot of good stuff coming up. And we're going to continue to increase our public outreach so we can engage more people in this. There are a couple other items I wanted to mention before we get into our public health report. One is some safety improvements that are headed our way from WSSC. It's about a year now since the tragic explosion at the Rock Friendly Garden Apartments in Silver Spring. That explosion and subsequent fire injured 14 people and impacted more than 150 people, and nearly $500,000 in donations were given by our community to help the victims of this explosion and fire. The explosion was ultimately found to be caused by an accident. A contractor mistakenly cut a gas pipe instead of a water pipe. And once that was discovered, I instructed my staff to work with our colleagues at WSSC Water to see what could be done to prevent a similar tragedy. Well, one thing they're discussing today and should be passed today is a bill that will require markings of all new installations of gas piping, both exposed and concealed, and it requires them to be identified and marked so they're easy to see. And you can see the gas code language on the screen right now. They're meeting, I think right now as we're talking about it. So hopefully this will come out. We continue to work on getting legislation or action to deal with pre-existing pipes in buildings. The ones in that building that exploded were not marked. And it may be too much to assume that a handy person who's hired knows the difference just by looking at the metal between a water line and a gas line. And we're going to push for whatever we can do to make sure that everything gets labeled in an apartment's basement. These revisions do include making the marking mandatory, which is good going forward. And I'm glad that the changes being made, and we're going to continue to do everything we can to prevent dangerous situations like this from threatening people and destroying their homes. And I want to thank WSSC for collaborating with us on this. Yesterday was Valentine's Day, and we were met by a dose of scary statistics from the CDC about the state of teenage girls in our nation. And they clearly show that this group needs a little bit of love and attention because there are some serious issues out there. Nearly 1 in 3 high school girls reported in 2021 that they seriously considered suicide, 60% increase from a decade ago. 3 in 5 teenage girls report feeling sad so often that it's impacted their regular activities. This is double the level that the boys reported. Report shows a higher rate of drug and alcohol use for girls and more instances of being bullied online. 15% of teen girls said they were forced to have sex, 27% over 2 years ago, and the first increase since the CDC began tracking it. At least 1 in 10 girls were raped, and that's the highest level the CDC has ever seen. And in Maryland, 1 in 10 high school students reported experiencing physical or sexual dating violence. These numbers are alarming, and we cannot assume that our teenage girls, as well as boys, and those who do not gender identify, are immune from the stresses, traumas, and the pressures. February is Teen Dating Violence Awareness and Prevention Month in Montgomery County, and this is an issue we've been and will continue to take seriously all year long. And we were there at the council earlier this week to read a proclamation, but also to bring together folks who work in this space and acknowledge the work they're doing. MCPS joined us in the Family Justice Center, the County Commission for Women, the Domestic Violence and Coordinating Council, the Maryland Department of Parole and Probation for this proclamation to talk about the issues that are faced primarily by young women. We're also raising awareness about teen dating violence through the end of February by lighting up Veterans Plaza in Orange each night. I encourage all those in the media to consider covering our Domestic Violence Coordinating Council's Choose Respect Montgomery initiative, which is teaching teens and parents and educators and youth serving professionals about healthy and unhealthy relationships, warning signs, and how to help befriend them more. They also created events like Respect Fest and organized the Choose Respect video contest that reaches thousands of teens and families in Montgomery County. The Prevention Initiative offers awareness and education programs for teens through videos and public service campaigns. And right now, the group is asking students to submit their own public service announcement videos for Respect Fest this coming April. Last year, 346 entries were turned in, and more than 500 students had a hand in putting these videos together. They're very powerful, and they're effective because they come from a student's perspective in terms of how they're talking to other students. And we know that the most influential communicators to teens are other teens. We hope these peer-to-peer messages that highlight warning signs and deliver messages to help students recognize they're never alone and how important it is to find help. As a government, we're going to have to continue to support and expand and routinely communicate about the resources we provide, such as the Family Justice Center and the Crisis Center, as well as our nonprofit partners. And every family in the county should know the number to our Crisis Center, and it's 240-777-4000. The Crisis Center provides free crisis services 24 hours a day, 365 days a year. They also provide services in person in Rockville with no appointment needed. In addition, our mobile crisis teams provide emergency crisis evaluations for individuals who are experiencing a mental health crisis. Full crisis assessments and treatment referrals are provided for all crises, and both psychiatric and situational. And in addition, we offer crisis beds as an alternative to hospitalization for those who are uninsured or who are insured within the public mental health system. We need to remember that the impact of abuse on a young person can last a lifetime, and we need to do whatever we can do to prevent that. I think people have to look closely at what happens in families and what happens in the community at large. It is, these things don't start in school, and certainly nobody teaches boys to behave the way they behave, and doesn't teach girls to accept that as what they have to put up with. But there are lots of behaviors which, in my opinion, and I will say that speaking as a teacher, too many adults turn their backs on, things that people do that are clearly aggressive. And the words I hate most when you talk about a boy doing something inappropriate to a girl is when somebody says, boys will be boys. If boys will be boys and nobody puts a brake on it, they're going to grow up to be not the kind of men you would want to have a relationship or be around. And we can't ignore the social cues that we all see and then don't say anything about. So it's important that we not just look to mental health workers and how many mental health staff the county can provide to prevent a problem that's largely driven by the messages we send kids when they're very young. So if we want this to change, we have to put a lot more emphasis and thought into how we react to things that, while we may not think they're appropriate, we don't take the time and trouble to say to a kid, that's not appropriate. We need to be able to do that. Going to our community health update, there are good signs this week when looking over case rates and the hospital beds devoted to COVID-19 patients. As you can see in the charts above, they're lower than last week's metrics, and our community level status remains low. The only demographic that draws the most concern really is older residents. They count for a lion's share of the more than 100 people hospitalized and fighting COVID. They will continue, for all the reasons we've talked about, to be, the primary targets of COVID. And so everybody, we're not just talking about protecting yourself, but the things you do help protect other people, and doing things that make sure that we're not exposing our senior population to COVID are things we all should be sensitive to. And the best way to stay out of the hospital is to be up to date on your vaccines and bivalent boosters. Unfortunately, we're continuing to see fewer people each week getting their shots. We're down to less than 3,000 booster shots distributed per week across Montgomery County. In October, the county averaged 25,000 shots a week. Within the next few months, our county is likely to lose the COVID overflow hospital that opened in Tacoma Park in response to the pandemic. It allowed us to manage the quick rise in RSV and flu cases a few months ago and keep bed spaces open for the rise of COVID cases this past December. We still saw a strain on our resources. Our hospitals are just not equipped to deal with the massive amounts of people who had to be hospitalized due to COVID or due to the two other factors. It's up to us to help protect ourselves, our families, and our communities by spreading the word that boosters and vaccines are effective and remain necessary. So when the time comes for you to get your next booster, please come in and get it. And if you haven't gotten your booster already, particularly the bivalent booster, you should come in and get the bivalent booster. It'll keep you safer, and it's certainly going to keep the people around you safer. Other health concerns, 2 fentanyl awareness forums are going to be set up to close in February. The first will be February 21st for Spanish speakers, and it'll be virtual. And we encourage everyone to sign up early through our Montgomery County and Espanol Facebook page. And the second community event is going to be Saturday, February 25th, and it's going to be a hybrid event. The in-person portion of that meeting will be at Northwood High School starting at 9:30 a.m. And with that, I'm going to turn this over to Sean O'Donnell, Dr. Davis, and Dr. Bridgers for any comments, and then we'll take your questions. Thank you very much.
Thank you, Mr. County Executive. Appreciate your patience. I'm trying to pull up. Here we go. So to add on, the county executive provided a very good overview that there has not been much changes to the COVID report. We're continuing to see in our region the same variants that we've reported on previously. Again, we have now a few weeks of sustained decreases, not only in our hospitalizations, but in our emergency department visits. This is, you can see to the right of this chart, much lower levels of ED visits each day, much lower than what we were seeing earlier in January. This is the data that was mentioned here, where we're looking at the overall flu-like symptoms, which includes COVID and includes other respiratory disease, visits across all of our hospitals, and by age group. And you can see most of the ages remain at lower levels. There's still an underlying amount. We're still in that respiratory disease season, so that these are still being transmitted. COVID, the current variants of COVID are still highly transmissible. So that's still occurring, but at much lower levels than we saw previously. And you can see in the bottom box, our 65 plus has not come down as much as the other ones have. And so we're still monitoring that. Again, we've shared this. There are links that to the CDC website that's now reporting on the benefits of the bivalent booster since they began distributing that throughout the country. The lowest line is showing much lower incident rates per 100,000 for those who had the bivalent than people who had other ranges of COVID vaccines. And they update each week as they update the numbers. The protective effects changes a little bit, but every week that they have more data, we'll see this come into greater focus of how much protection that we're seeing from the bivalent boosters. It's about 3 times as lower rate of hospitalizations than people who have not gotten the booster, even if they've gotten the other COVID vaccines. So that this booster that came out back in September, it's a different component than the previous vaccines that have been offered. Again, we've seen a reduction so far. About halfway through February, we've started to see a reduction in the mortality from COVID, which is encouraging. It's still much higher than what we see for influenza, but it's fortunately starting to come down as we expected it to. And then finally, just to share what we're looking at for influenza across our state of Maryland. That's the red line is this year. You can see that it's come down drastically from where it was, but we still do have a level of this going on. It's just at a much lower rate than what we saw in December, November, December, and into January. Only 2 more deaths to report over the last week across the state of Maryland for influenza. So again, you can see this is much lower than COVID, which is why we're still offering COVID vaccinations out to the community. And again, there's no charge for these vaccines. So we do encourage people to come and get that now if they haven't gotten the booster yet. Now I'd like to see if my colleagues, Dr. Davis or Dr. Bridgers, have anything they'd like to add.
No, thank you, Mr. O'Donnell. I think the only thing to reiterate is that the vaccines are still effective. We do still encourage folks to get them. And they are still free and available through the county as long as the public health emergency is available. And so encourage folks to take advantage of that while it continues to be available.
Thank you, Mr. O'Donnell and Dr. Davis. Same space, so I concur. So we are all in one accord regarding the access and the need to increase our capacity to stay up to date with the bivalent vaccine. So I'll stop there, Lorna, and I'll turn it back over to you for our Q&A session.
Thank you very much, gentlemen. And we do have the first set of questions coming in from Steve Monell, Moco 360. Good afternoon, Steve.
Afternoon. I think the county executive is probably best positioned to handle this first one. I know you had said that they're finalizing this policy to require that gas lines are, marked. I'm just wondering on the county's end, I'm sure there was a lot of kind of finer details to sort out in terms of that regulation. Can you just kind of provide our readers more context, because it's been, like you said, almost a year since that explosion. It seems like a simple fix, but I'm guessing there's more to it than just, saying that the lines need to be marked, if you catch what I'm asking.
Yeah, I'm still a little bit frustrated by the response to all this. WSSC said they can set requirements for new, but they couldn't set requirements for existing. And so that's why the legislation today is for new. We're looking at 2018 legislation that was passed, and our folks in terms of our own inspectors in Department of Permitting Services, they appear to be limited basically also to new construction. And when they do inspections on older buildings, they don't have the authority to say these pipes aren't marked. So we're trying to understand where that authority has to come from, or can we simply require it, even if we don't have enforcement, to at least require them to mark their facilities appropriately. So we're going to continue to push farther. I was happy they did this on all the new stuff, but I do think we've got to make it mandated in all of the older units, not just some of them.
So we're still at square, given the age of the buildings, it doesn't impact anything like that, essentially, this change.
Yeah, so I had a conversation about this because I saw the legislation they were dealing with, and what struck me when I look back on some of the other legislation, there's a discussion about what pipes have to be used, and I think they solved the problem that anybody would just walk into the basement and identify what was a steel or an iron pipe and what wasn't. And I think reality is that a lot of the maintenance workers who do this work actually don't know that, and wouldn't be able to tell what type of a pipe was, that had any specific meaning. Obviously, if everybody was trained and had the proper training before they did the work, but the example of Friendly Gardens was somebody who didn't know the difference between pipes. So I'm going to keep pushing on it because I want a little better resolution than what we've got so far.
And not to belabor it, but the training that you mentioned, does the county have any authority there in terms of requiring that, or is that, I'm sure are you still exploring that, I guess?
That's an option we could probably go to in terms of licensing, requiring that employees go through training. I'm sure they would consider that onerous, but if we can't figure out another fix, I think we're going to have to start doing that as a requirement, and require training on things. We can't have people going into buildings that don't know what they're looking at.
Do you have a timetable on when you would try and get those changes, if that's next 6 months, year?
I'm trying to do this in less than that. We actually had a conversation about clarifying what we would need to do, or what exactly the limits are. Could WSSC authorize us to inspect? Because WSSC doesn't have the inspectors to go out and do all these buildings. So I'm going to push on it and figure out a way to get this done the way it should get done.
Okay, thanks, sir. And these next questions for the health team. Obviously, a lot of people have seen that was referenced this CDC study on teenage girls. I'm just, obviously this was a nationwide kind of review. do we anticipate that the data that's kind of, highlighted in this study where it comes to teenage girls are more suicidal than all the other kind of troubling data points, do we anticipate that that matches up with what we're seeing locally, as simple as that sounds?
It seems to. I don't know if Dr. Davis wants to talk about it a little bit.
It seems to. I mean, we haven't dug that deep. I don't have the briefing on kind of what the numbers are in Montgomery County, but I don't think that we are much different from the overview that you saw in that report in terms of just, the needs that we're seeing from girls, and I think of boys too. And again, it kind of gets back to this broader mental health issue, if not crisis, that we're facing, and really thinking about how we have enough supports in place to support our children and youth and their mental health needs.
There are a lot of, to sound like a broken record, concerning things about the report. Does anything rise to the top in terms of what was most surprising or distressing, or is it the entire report, as simple as that sounds? And again, anyone can feel that.
I mean, from my end, it's the entire report. I mean, it's hard to pick apart the suicide, the sexual violence, the trauma. And I think while the report was focused on girls, on the plight of girls, there's also there's a problem with our boys if girls are experiencing that. And so how we think about, both sides of that continuum.
And I guess, how will you use this to inform policy decisions, whatever they may be, moving forward?
I mean, I think it just, it continues to feed and push us forward as we're talking about, mental health challenges, our partnership with the school system, and thinking about the wellness centers that we have in school and that outreach. I think it just lends additional support for, having those resources, especially in schools, but also in the broader community.
Do you think that those centers and summer models need to be expanded, given what this report shows?
I think all of the resources need to be expanded. And, as we look at what the best place to do, I don't know that there is not one overall solution. It's going to take a lot of solutions to really get there.
Thank you, everyone.
Thank you, Steve. Members of the media, any other questions for the officials? Heather Curtis, WMAL. Good afternoon, Heather.
Good afternoon. So I have a question for the county executive. Mr. Elrich, we received the press release about the Montgomery Connects computer program. I'm wondering if you could talk a little bit about that and how successful it's been so far.
The Montgomery Connects computer program. You mean the one where we're giving out these computers? It's been incredibly successful. I've been to a couple of the handouts, and we've given away tens of thousands of computers. And it's, we're tying that. A number of the cable providers are also offering discounts at this event, and there are some other opportunities to get reduced price service. And so we're able to give people both the computers and connections to ways to save money on getting basic cable service. The service is a little bit above the bare minimum, which some of the cable networks had offered before. And we were giving out more than one computer per household, which is, really important. A lot of people think, well, one computer ought to do it. But if you've got 3 kids and they're in school and they all have home assignments, I need a computer for every kid to be able to do their work. So I've been really happy with it. And I think, the county's been actually extending Wi-Fi service on our own into a number of apartment buildings, and we're going to continue to do that. We're able to use our own network and expand it because we want to make sure people have access and the price doesn't become a barrier to people having access.
Do you have any idea, Mr. Elrich, what percentage of people in the county can't afford internet access and maybe don't have access to a computer at home? It's sad because it's something I think we all just take for granted.
I don't know if there's a number of how many people can or can't afford it. We can follow up with you though. But I'd say, when you're in a county where there are over 50,000 households under $50,000 of income. You got a lot of people whose rent is consuming pretty much most of what they have and can't afford a whole lot else.
Thank you.
Thank you, Heather. Members of the media, any more questions for the officials? No more questions today? Going once? Twice? Well, thank you everybody for joining us this afternoon. Stay safe and we'll see you next time.
Thank you all.
Have a good afternoon all.